Okay, hey everybody. We will get started now. Welcome to our second meeting of the semester. Just like last, if you have a question, feel free to unmute yourself and ask away, or you can type it into the chat and myself or one of the other execs will address the question or just answer it right in the chat. Also, as you probably heard the nice Zoom lady say once you joined, this meeting is being recorded and it will be posted on our UVic GB YouTube account for those of you that missed the meeting or want to go back and look at it. So if you don't want your face to be on the recording, make sure to turn your camera off. I'm not sure who it picks this show, so maybe it's just me because I'm talking. So today we're going to talk a bit about, I'll give you a brief overview of Global Brigades again, in case anyone missed last week, and then we'll do a super quick, super fun icebreaker. Then we're going to get into what a traditional brigade looks like. So what a brigade was pre-COVID, because there's been a lot of changes since. And then we'll talk about how Global Brigades is responding to the pandemic, and our presidents are going to discuss how each program has changed. Next, Cole, our campus chair, will talk about TeleBrigades, which I know I'm super excited to hear about, and I'm sure all of you guys are dying to hear. And then we'll finish with our fundraisers, going over some upcoming events and talking about our point system. So what is Global Brigades? Global Brigades is a nonprofit organization that runs globally with volunteers from all over North America and Europe, and it coordinates brigades in Honduras, Nicaragua, Panama, Greece, and Ghana. The mission of Global Brigades is to focus on sustainable development through the implementation of the holistic model in hopes to resolve global health and economic disparities while inspiring all involved to collaboratively work together for an equal world. I think one of the biggest impacts that Global Brigades left on me last year when I joined was kind of learning how and seeing firsthand how their goals can bring people together from all over the world to help each other. And I just thought it was a huge impact. It left a huge impact on me on how much good can be done when people just work together. So I hope you guys start to see that pattern throughout. But back to the description, the end goal of Global Brigades is to no longer be needed in their partnered communities, so that the communities can become self-sustainable in all aspects of the holistic model. And then once this goal is reached, that's when we call the communities an empowered community, which is ultimately the goal. We want everyone to not need us on a hands-on level anymore. Does anyone have questions about that? Just a really quick overview of what the club is itself. If you want to know a bit more about how we run at UVic, we're going to get into a lot of it, but also feel free to go to our YouTube channel, which I will attach in our meeting minutes, and you can watch last week's meeting, which went a bit more in depth about everything. Okay, now for the fun part. We have this icebreaker. How it's going to work is it might take a long time. I didn't see how many participants were in our meeting. We have 20, so we might get through everybody. But what's going to happen is I'm just going to call on somebody. I'll say your name, and then you're going to pick a number between 1 and 99. And then I have a corresponding question that I'm going to ask you. It'll be something easy like, what was your first car? Or where would you like to travel when traveling opens up? Something super easy, just a really quick answer. It'll be fun to kind of get to know each other a little bit more. We're only going to do this for 10 minutes, so you may or may not get asked a question. If you don't want to answer the question, totally fine. Just say pass, or you could just like leave your mic muted and don't say anything. I'll just move on. And if you don't get asked a question and you want to, don't worry, because we'll be doing this. We can do this again next week if you guys have as much fun as I did last night when I was organizing this. I'm going to put this up here and I'll cross out the numbers that have been picked so that we don't have to have the same question, okay? So first person I'm going to pick on is Kate Harrington. Kate, you know who you are.
Yes.
Pick a number.
17.
Okay. Okay. When you were a kid, what did you want to be when you grew up?
I think the earliest thing is actually a doctor.
Oh, cool. Is that still your plan?
Yeah, or something just in the healthcare.
Nice. That's really cool.
Yeah.
Awesome. Thanks, Kate. How about Natalia? If you want to pick a number, Natalia, you can. If not, I can move on to the next person.
Natalia, I can see you talking. I don't know if you're muted or not.
Oh yeah, I can't really see anybody, so. I'll come back to you, Natalia.
Oh, she just said 41 in the.
Okay, cool. 41. What would you do if you had tomorrow off from work? If she puts it in the chat, Sam, can you read it out, please?
Yeah, no problem. The question was, what would you do if you had tomorrow off from work? Did it not like pop up at the bottom for everybody? Natalia said she'd go hiking in Strathcona, but I don't know if everybody can see that.
Cool. I couldn't see it, but that's because I think I'm presenting. Nice. I would definitely want to do that too. Jessica King.
70.
Okay. What is your favorite town in the world?
Probably Nice in France. I just like
cool.
the vibe there.
Man, I wish I've been there. Nicole Larson.
Hi, I'm 3 people today. Hello.
Okay, you can each pick one.
Oh God. Okay.
One at a time, though.
I guess I'll do 11.
Okay, 11 for Nicole. What activity is at the top of your bucket list?
Skydiving.
Nice. That's up there for me too. Okay, who else is in the call with you? I can see Shao.
Hi. I'll do 33.
Okay. What is your favorite flavor of ice cream?
Oh wow, that's actually a really hard question. Probably bubblegum.
Ooh, nice.
Shut up.
Okay, one more question?
Yeah.
One more number?
I'll take number 98, please.
98. What is the most interested icebreaker question you've ever been asked?
How much does a polar bear weigh?
Oh, do you know the answer?
Enough to break the ice.
Oh, nice. That was good. Didn't see that coming. Okay, cool. Thanks, guys.
Cool.
Zoe Garlinsky-Gonski. I don't know how to say your last name, Zoe.
Hi. I will pick 57.
If you had to live in another country for 1 year, what country would it be?
Probably Australia.
Nice. Have you been there before?
No, I really want to go there.
Yeah, me too. Danielle Marr.
I'll choose 13.
Okay. What is your favorite comedy movie?
Comedy movie. I only watch comedy TV shows.
Oh, you can tell us one of those if you want.
I'm a big Friends fan.
Nice. Good choice. Sarah Keating.
Let's do 55.
What is a recent commercial you enjoyed watching?
I don't watch TV.
Darn.
I like haven't seen any.
Does anyone have a good commercial they can tell Sarah about?
Please. No.
Yeah, I'm in the same boat. I mean, I'm a Netflix fan.
Yeah, I don't think people. Well, some people watch TV. Anyways.
Anyways, we'll move on. Okay, I think I'm saying this right. Is it Aisha?
Hi, Aisha.
Aisha, sorry.
It's all good. It's a weird one.
It's a cool one. What number do you want?
I'm gonna do 25.
What is your favorite, or sorry, who is your favorite singer / musical group?
Oh, that's hard. Currently, I'm gonna say I've really been into the BTS. I'm gonna admit it.
Nice, good. Own it. Kaylin. I think there's only one Caitlin.
44.
Okay. Ooh, this one's a tough one. What is your favorite quote?
Oh, that one is hard. I can't remember who said this, but it was like, if someone took all your money away, how much would you be worth?
Ooh, interesting. That's a good one. Lauren.
Can I get, I'll do 1.
One, nice. Okay. If you could meet anybody in the world right now, who would it be and why?
I really want to meet David Attenborough right now. I just watched his new movie. And I think he's a cool guy. So that's it.
Cool. Nice. Okay, we're only gonna do a few more. Reed.
I'll go with 43.
Okay. If you could meet any US president, alive or dead, who would it be?
Oh my goodness. I guess I would meet Obama. I don't know. I don't really have a reasoning. Just him.
Yeah.
Seems like a cool guy. Yeah.
Cool. Sam. Sam Story.
68.
What is it? What is your favorite sports team?
Oh my god, I'm not a big sports guy. I don't even know. I don't even have a favorite sports team. I guess.
You can pick another question if you want.
Yeah. Okay. Oh, like another number. Let's go 23.
Okay. What is one activity you've always wanted to try?
But like I've never done.
You're.
I guess I'd have to say engineering brigade.
Ooh. Well, you might be able to try that one.
Maybe. Yeah. Hopefully.
Peyton.
I'll go with 10.
Okay. What is the strangest thing you've ever ate?
Oh my goodness. I was in South Africa a few years ago and I ate some sort of, I don't even know what it was called or how it's pronounced, some sort of local deer animal.
Oh.
It didn't taste bad, but it was very strange.
It was strange. Yep, I can see that. Cool. Okay, I haven't been keeping track of who I've been asking. Okay, I don't know how to say your name and I apologize. It starts with an O. I don't even want to try it. Oksana?
Yeah, Oksana, you're good. You're close. 16.
Okay. What was your favorite toy as a child?
Oh boy. I really enjoyed stuffed animals, I'd probably have to say.
That's fair. That's a good choice. Okay, another hard name, really cool looking name. Starts with an L. Your last name's Wu. You don't know how to say your first name. How do I say your name?
Lindsay.
Oh, cool. Okay. Pick a number, Lindsay.
Number 3.
Okay. If you could meet a superhero, who would it be and why?
Oh. I'm not really in touch with all that stuff.
Me neither. That's okay. Do you want another question?
Sure, yeah.
Okay, pick another number.
9.
Okay. Where is your favorite vacation spot?
That I've been to or that I want to
Either
go?
or.
I think going to Iceland would be really cool.
Cool. That's definitely one of my top want to go places as well.
Yeah.
Cool. I think I've got mostly everybody. Did someone not get to a question? I apologize if I missed your name.
Veda, I'd like you to answer a question.
Sure. Can you pick the number for me? Because I've kind of read through all the questions.
69.
Okay. If you could meet any living famous athlete, who would it be? I don't know how many people know this person, but PK Subban, he's a hockey player. He used to be my favorite player. So I'd want to meet him. Thanks, Sarah.
Thank you.
Yeah, no, no problem. Okay, thanks for playing, guys. That was kind of fun. Let's move on. So back to business. Oh no, my annotations are everywhere. Okay. So what is a brigade? So brigades is in our name. You've probably heard it a million times, but what does it really mean? A brigade is essentially a group of volunteers, so just like us, who are driven towards positive social change. Traditionally, so before COVID hit and there was no travel restrictions or global health concerns, a brigade was a hands-on, skill-based 1 to 3 week program in one of our partner countries. At UVic, a brigade may be medical-based, engineering-based, or business-based, and each of these programs meets an aspect of the holistic model. And aims to strengthen the health and economic development in communities. So that's basically what a brigade is traditionally. We're going to get into what a brigade looks like this year in response to the COVID challenges. But like I mentioned last week, you can join any brigade you have interest in. You don't need to be a pre-med student to join medicine. You could be maybe on the verge of medicine or engineering, or honestly anything, research. And then as long as you're here to help and you want to help people, you're in the right place. And maybe this will be a place that helps you solidify what you want to do in the future, which I know it has done for a lot of people. We're going to move into talking about each program's specific brigade, what they are traditionally and how they've responded to COVID. Each of our chapter presidents are going to go and speak about their brigade. Unfortunately, our business brigade president, Sophie, wasn't able to make it tonight. So we're going to save her business talk for next meeting, but we're going to start with our medical brigade president, Sam. The stage is yours.
Hello, everybody. So yeah, I'm going to talk to you about the medical brigade. I mean, it's kind of hard for me to say that it's just my favorite because I haven't gone on any of the other ones really, but it is definitely my favorite so far. And I want to talk to you a little bit about what it means for our partner communities first and sort of how we go about that. So medical brigade is, Veda mentioned the holistic model of sustainable development at the beginning of this meeting. And the sustainable health is the very first step in that holistic model. And in the sustainable health sort of umbrella, we have medical brigades, which is fantastic. It's such an awesome brigade type because it's really sort of like the forefront of this whole path to sustainable development. And the biggest thing that we accomplish on these medical brigades is the implementation of mobile health clinics. So these are super exciting. Generally, they're about 4 days long, and we work with local community members, local physicians, physicians from international standings, and some from Canada as well. And we run through several different stations. So we've got an intake station, triage station, a consult with one of the physicians. We've got dental station, gyno, optometry, and then we've got public health education, which is sort of like Charla. So with kids, you get to just play around with the little kids and educate them on oral hygiene and just general hygiene and such. And then with the adults, this is generally done by the community volunteers, but they get educated on, like sexual health and such. But all in all, it's a fantastic experience. I think last year we saw over 1,000 people through the clinic over the 4 days. And you get right in there, you're working right beside, fantastic doctors and such, and it's wicked. So what does this mean like for you as someone who's joining a medical brigade? I mean, one of the top things that I got from it is I now have access to this massive group of super like-minded individuals. You get to an opportunity to gain leadership experience. So I mean, this is my 3rd year of brigades. I started as a general member, didn't really know what to expect at all, went into this. And then the next year I went into an executive position because I loved it so much. And now here I am as medical president. But I mean, it's a rare opportunity to get that sort of fast track into a leadership position. And especially if you are really passionate about it, it's really fun. You can develop international relationships, as I was mentioning before, with like the international and local physicians and dentists and community workers. And I mean, it's not like you're going to meet them over these 4 days and then never see them again. I went back for the 2nd year and I, saw people that I'd worked with before, and I got to tell them, how my life was going, hear how their life was going. Another hugely important thing is you can build your medical knowledge with skill-based volunteering, which is super exciting. It's not something that you get to do in Canada very often, especially as an undergraduate student. So you're working with local physicians. They're sort of telling you about, you do unique epidemiological cases and such, and you're seeing, I mean, if you're in gyno station, which is only for females, but like you get to watch, pap smears and stuff like that. You get to watch teeth extractions in dental, take prescriptions in the optometry station. You develop cultural competency, which is awesome. You learn so much about the culture in Honduras, and especially in these tiny little rural communities, because that's so different from what's experienced in larger cities like Tegucigalpa and such. That's kind of like an underrated feature of medical brigades. I didn't really expect how much of an impact that would have on me, but it certainly did. And lastly, I mean, you're making a real difference in these communities, right? We saw 1,000 people, over 1,000 people. We gave out the most insane amount of medications and such. It's a fantastic experience, and I would highly recommend it to anybody who wants to go into medicine, especially. But I mean, for anybody too. It's kind of like a once in a lifetime thing. But yeah, that's my spiel. And right, I forgot I was going to talk about the changes. So yes, this year is different. I mean, it's different for everything, right? So how Global Brigades is kind of going about this. In country, we're doing there are some changes. So the first off is we postponed all the brigades until March 21st or March 1st of next year at least. But we're still getting monthly access to physicians for people in these rural communities, and we're getting medication at a significant discount for these partner communities. The way we're going about this is through the money that we're fundraising and also spending, or and contributing for the TeleBrigades, which we'll talk about in a little bit. We're able to make bulk purchases of medications and sell them at a highly discounted rate. So they're essentially subsidized. And what this is doing is covering the cost of the doctors and some of the operating costs of Global Brigades in country. We're also offering like very discounted fee-for-service optometry stations and dental stations in country. Another recent development, which we didn't have before, is an urban clinic in Tegucigalpa. So this is going to be fantastic for those that are at a disadvantage and maybe might not be able to access some of the sort of standard healthcare that they have, even in the larger cities. And so this is going to be like a huge movement for people, especially like during times like COVID, where maybe they just could not possibly risk going into a larger hospital. We're going to get to see a lot more of this for the in-person brigades of the future, as well as the TeleBrigades. And I'll talk about that a little bit more in a bit. But yeah, those are some of the changes that we've made to kind of get around this COVID-19 business.
I don't think they're on yet, Beta.
Yeah, I see that. Okay, we can come back to, or I can just kind of read over what the engineering brigade's about, and then when our presidents show up, they're just getting off work, they can talk about it. Does that sound okay?
Sure, yeah. I want to make one clarification really quickly about one of the things that Sam said about the prescription medication. Just really quickly, this is something that's kind of in the works and has been for a little bit, but it's a change from what, and this is mostly going to be information for returning members, but it's a change in how brigades are going to be done for the foreseeable future. So it's not just because of COVID-19. What they're doing is in a lot of these sustainable communities that they believe have reached, a few, sorry about that. Have reached a stage in the holistic model is instead of providing all of the medication for free in these communities, what they're going to be doing instead is they have partnerships with pharmacies all across Tegucigalpa and Honduras, and this is specific to Honduras right now because it's kind of the first country that they worked in the past. But what they're going to be doing is leveraging that so that instead of us giving out medication for free at our brigades, at our in-person brigades, we are now going to be charging community members a fraction of the price. And this is going to just help brigades become a little bit more sustainable. So it's going to reduce the cost for volunteers to be able to come in. And it's also going to help, the money will then go towards something that Sophie was going to talk about, which is community-owned banks. And then they're able to push their own development in their country. Just to clarify that so that that's a little bit easier. But yeah, go ahead, Beta.
Thanks, Cole. I saw that Jess just popped on. Jess, that was perfect timing. Are you prepared to talk about the engineering brigade a little bit?
Yeah. Wait, mic check. Is this good? Is this too loud?
It's a little quiet, honestly.
Yeah. Okay. What if I put it right here?
Say something.
How about now? Is that better?
It should be good. It should be. Yeah, it's clear.
Okay, I hope it's clear. All right. Hi, guys. So my name is Jess. I'm the Engineering Brigade co-president. So what's involved in the Engineering Brigade is essentially that we will be going into communities to help them get access to clean water. We'll be helping them develop their infrastructure. And this, in return, kind of helps them have continuous access to clean water, which is vital for the sustainable empowerment of a community and improving their health, sanitation, education. So why is the engineering brigade important? So unfortunately, the reality of the rural communities is that they have quite a few caveats to how they access water. So for many families, they have to walk over 30 minutes to a water source before they actually have access to water. And then they have to carry those buckets, like a 20-liter bucket, back to their homes, which is kind of difficult. And then they have to chlorinate it themselves at their house. The quantity is insufficient. Like I said, the 20-liter buckets, it's not enough. Quality, in some cases, there's no water treatment facilities for them. So essentially, they're just taking water straight from the source of a mountain rather than having it treated and being able to have a potable water source. And then finally is the infrastructure. It's just outdated. And that's the thing that we work to help them strive to achieve, to build new infrastructure that helps them proceed in new adventures. So what is involved in the engineering brigade? So for a volunteer, all that's really all your sorry, I just got off work, so this was quick for me. So you're gonna have practical experience in solving engineering challenges, right? It's not the stuff that you just do off the paper and all. You're gonna be actually like learning about how water is going downstream and any like actual challenges in like the actual profile of the water alignment. Um, you learn about sustainable practices that involves like choosing the materials, how to reduce material use, and overall water consumption. You learn to use new softwares, which the technical technicians will help you learn to use. And then, most importantly, you make tangible impacts that you can actually see benefit the community. Oh dear, this is Alan's slides. All right. So Alan was supposed to be talking about this, but so traditionally GB contributes to 1/3 of the construction costs of the community-wide water systems. So as part of the WASH program, to adjust to the financial demand, GB is working towards having the portion covered by community banks as long-term low-interest loans. So before it was kind of funded by government and private sectors. So now we're shifting towards more community-based. Next slide.
Okay, so I'm going to talk about a new program. I'm not going to talk. I'm going to talk more general than anything else. I'm not going to talk about the specifics of a medical or an engineering or a business telebrigade, but I'm going to talk a little bit about some of the changes that are being made so that they can still have volunteers getting involved with Global Brigades from a distance. Before I go into that, though, I just want to thank anybody, if there's anyone on this call that went to Soap for Hope this morning. I know that we did get enough volunteers. That's a really awesome that we could get people there. I was too bad I wasn't able there to make it myself, but thanks anyone who was able to do that. But yeah, I'll talk about TeleBrigades. So the TeleBrigades were introduced in order to counter the health and travel restrictions that have arisen due to COVID-19. And Global Brigades is introducing them as TeleBrigades. So they describe TeleBrigades as the world's first virtual experience-based learning program that provides international volunteers with opportunities to university students. So it allows us to, in part, continue the humanitarian efforts and support that we volunteers provide to the various GB chapters from our own home. So currently Global Brigades is offering a medical, a public health, a business, and an engineering telebrigade. However, I've been informed that there's soon going to be a new telebrigade called Global Legal Empowerment, which is pretty exciting. I've never been on that. We had a president at one point who did go on a Global Legal Empowerment brigade in Panama, and he said it was a really great success. And if you have any questions about some of the other brigade types, please feel free to reach out to us after the meeting. But as such, UVic GB is going to be offering the medical, business, and engineering brigades on these new virtual platforms in 2021 for the 2021 brigade, which we still plan to have in February. So before I talk about kind of what you can expect from a telebrigade, I just want to make it very clear that telebrigades is not a replacement for in-person brigades. Everyone on the executive team is really disappointed that in-person brigades are being canceled and postponed until March at the very earliest. And we discussed the possibility of doing summer in-person brigades. However, the amount of uncertainty still surrounding the availability and safety of in-person brigades, we kind of decided to go against it. At the end of the day, what we decided was to put the health, the safety, and the finance of our volunteers first and proceed with this new program. So the last thing we'd want is to have, anyone involved commit, immense amounts of time and money and effort to have a brigade canceled or an individual, return home sick. So, this is kind of our thinking about it. And if you have any questions or, comments or concerns about a decision, please feel free to reach out to us. But that being said, I am very excited about telebrigades. And the presidents will give you a breakdown of their telebrigade specifics, but what you can expect from telebrigades is basically 7 to 9 modules, each of which consist of 1 to 2 hours of brigade-based activities, followed by self-paced activities. And so each of these sessions kind of takes into consideration particular aspects of an in-person brigade, but it still exposes us to brigade experience while also placing a lot larger importance on cultural awareness and understanding. So I've talked to a couple other campus chairpersons across Canada, and they've got to actually take part in a TeleBrigade. And they were saying, even after 4 years of being involved in Global Brigades, they were learning, things about the programs and things about the organization that, they wouldn't have had exposure to otherwise, unless it was specifically being told, or to about certain elements of the countries that they've even traveled to. So they say it's a really a cool experience. So you can go to the next slide though. Oh no, perfect, you're on top of it. So this year we have the opportunity to be kind of in the front of program development at Global Brigades while they cultivate a brand new and long lasting opportunity. And so TeleBrigades is here to stay. And so for the next few years, we're going to be offering international humanitarian work and virtual cultural immersion and exposure from the safety of your home. So we're going to have the opportunity. These are just the benefits I'm going through. But TeleBrigades is going to be highly customizable. So we're going to be able to, customize our TeleBrigade experience and add in certain elements like additional stations, like the rural clinic that Sam was talking about that I'm very excited for. That's going to be a new station that's going to be added in our TeleBrigade. It's going to be extremely flexible. So we'll have it's going to be a much smaller time commitment since we're going to conduct our TeleBrigade over a week or more period. We may also have the opportunity for members to participate in more than one TeleBrigade at a time, rather than just committing yourself to a med or an eng or a business brigade, once. That's something that I can't promise, but I would like to, if possible, participate in all 3 TeleBrigades since the time commitment is so low and they're going to be running. So another thing that's really huge is we don't need to worry about international travel. And that was a concern for a lot of members even before COVID-19. And since we're not going to be paying for flights, accommodations, or medical supplies specifically, there's a huge reduction in the individual cost for people to participate in a TeleBrigade. And so it's going to go from, most years our individual, cost per member is close to $2,000 if you consider everything like flights and all that. And now most TeleBrigades, before anybody gets, a discount on the brigades through their efforts, which Zoe and Sierra are going to talk about, they start off at about $400. So it's a huge, huge reduction. And I know it's not the same. You do miss, a few vital elements of that. But we're going with what COVID has placed in front of us. So at the end of the day, each volunteer is still going to walk away with, 20 hours of service at Global Brigades. They're going to get a certificate. In the case of business, which I wish Sophie was here to explain, but the business program has a lot of affiliations with really great companies like Deloitte, and they're going to be signing off on those. And I think the biggest thing of all this is that this is excellent for resume building. Everybody that's on the executive team or in Global Brigades at one point joined because it really was a great way to build your resume. And this is going to just be another one of those. So while it's not, an in-person brigade, it is still something that I look forward to. And there's a ton of upsides. But what's most exciting for me is the idea that we can be, among some of the first people in Global Brigades history to participate and then implement a new program into our club. And, with the adoption of TeleBrigades into our annual schedule, I think this is going to have a huge influence on UVic Global Brigades over the years. I think it's going to be able to expand our opportunity to bring in new people from, more than just UVic, but everywhere, even from different provinces, because you don't necessarily need to be in Victoria to get the social aspect of it. So there's a lot of really great things. And I think, regardless of the fact that we're not going to be able to take part in an in-person brigade and travel, I think considering, the risk that's associated due to COVID at this time, I think that it is, the best alternative for us. And it's a new opportunity, which I'm really excited for. That being said, if you guys are at all interested in doing an in-person brigade, and that's something that, you're set in stone on, you should reach out to me because, there are certain campus, chapters across Canada that will be hoping to do in-person brigades probably further into April and May. And, I'm happy to look and chat with some of those people to see, we collaborate with a lot of other campuses across Canada. And so if there's an opportunity for us to send some of you on one of their brigades, we'd be happy to arrange that. But anyway, I'm going to stop there and let the presidents talk about kind of their itinerary for the brigades, the TeleBrigades.
So I'm mostly just going to talk about some of the highlights of the TeleBrigade. There's as Cole mentioned, a bunch of different sections, and actually on the next slide, which we'll show in a little bit, I've got the sample itinerary, so what the entire medical TeleBrigade might look like. But there's some really cool stuff that we get to do, and like we said, obviously this isn't a replacement for the in-person brigade, but it is definitely supplementary. And it's going to be something that we can do for the future as well, even when we're back to doing in-person brigades. But some of what I was talking about before about skill-based volunteering medical experience with doctors. So we're going to be, okay. Also, I just got a notification that my internet connection's unstable, so please stop me if it starts getting bad. So yeah, shadowing consultations with doctors, people, and this will probably be in the urban clinic. We'll get to discuss with physicians common diagnoses and treatments that are kind of unique to this area. Some of the medications used that are just sort of specific and may not be used in like Western nations, as well as some of the traditional health practices, which is actually pretty cool because that if anybody who's applied to medical school will know that like in rural medicine, that's a huge topic. So it's pretty cool to see something like that from a physician who's worked in a developing nation for most of his life. We're going to get to witness like a live stream of the urban clinic that we were talking about before. We're not going to be able to live stream the rural clinics, but we will be able to get a recap from the physicians that went in there, and they're going to discuss, everything that they did, some of the unique epidemiological case studies that they witnessed and that we'll be able to go through. There'll be a couple seminars on the cultural context that I was sort of talking about before when I was talking about the brigade. And it's also going to be more frequent and, as Cole mentioned, more affordable, which is huge. I think I'm definitely excited for this. I think it's going to be a fantastic opportunity, and I definitely think that you guys should be. So yeah, this is just a sample itinerary. I don't know how it looks for you guys. It's definitely a little bit blurry there, but you can see like in the first couple. Like we might even be able to participate 2 or 3 and then at least get to witness the community selection process. We'll get community members talking about cultural context. We'll get to meet all the people that you would normally meet on an in-person brigade that are helping out, hear their stories, and get to kind of just sort of realize like who we're dealing with. The telemed things will be a little bit later on, after we've sort of established a context for it. So like you can see session 6 is the urban clinic day, and then the rural clinic recap will happen the next day. And then at the end of everything, what we did in-person brigades is a fairly in-depth reflection. This isn't just a reflection on what we did, but also how it impacted us, and how we felt that we've impacted the community members as well. It's a really sort of powerful experience, and I'm glad that they've included that in the TeleBrigades, because yeah, that was super underrated, especially going into it. But I mean, looking back on it now, that's one of the things that's most memorable for me as I look back on it. So yeah, that's kind of just like a sample itinerary. I mean, if you guys want to learn more about it, please feel free to reach out. But I just want
Hello, everybody. If you don't know who I am, sorry I was late to the meeting, but my name is Alan, and I'm the co-president of the engineering brigades. So I'll talk to you about engineering telebrigades and what you would expect from a telebrigade. I know, Cole, you did a rundown of what a general telebrigade is and what the format would look like. So for engineering brigades, it's kind of like a live case study of a community's water system. So you get you actually get the chance to put your engineering skills and develop your engineering skills, working with other brigaders and as well as engineering professionals that would be in country. So you have the opportunity to make an impact in the comfort of your own home while still remaining safe. So it's a good opportunity if you're looking to develop just, I guess, even kind of virtual business. If you're interested in business as well, or in mixing it into engineering, we do. I'll give you a rundown of some of the sessions that we're going to talk about after in the next slide. But in general, it'll be like a virtual consultation. We're going to utilize our video conferencing and software, online software, to design these water systems, hydraulic analysis software tools, and as well as budgeting. Budgeting is important for it's an important role and something that we had to present to the community to see if what kind of funding that they need, whether we need more funding from GB or we need to develop more funding from government organizations or local banks. So if Cole, you can just run to the next slide, or whoever is. Okay, so here's a sample itinerary of a TeleBrigade. They're broken down into each session, and sessions they're not on a day-to-day, as you can do them whenever you'd like, which we'll probably schedule. But similarly, first sessions will be kind of introductions, getting to know your community, getting to know your professionals that you'll be working with in person. Afterwards, we'll do some education and training, develop the cultural aspect of this community, learn about what they're wanting out of a water system and what their demands are. And afterwards, you would assess the existing infrastructure that you're given from in-person professional that would do all the surveying for you, and then we'll be given a package of surveying data, which will assess the existing infrastructure. Afterwards, we'll use all of this data and the geographic location of this community to design a water system that works for the specific community, for whatever community we're working with. And afterwards, after all that's done, we get to submit it and as well as present our designs to the community. So this would be live streamed, obviously, and presented to the community. They'll usually gather around and then they'll watch our live stream of our presentation. And we'll most likely do it in Spanish. So if you would like to learn Spanish, it's a good opportunity for you to develop your presentation skills in a different language. So can look forward to that. And afterwards, we also do an evaluation and follow-up of an existing community, just to make sure that a water system that has been designed from a different brigade is functioning, and we're not just leaving them without help. And that's pretty much it for all the sessions for an engineering telebrigade.
Hey everyone, we're going to talk about the fundraising point system now. If you could switch slides. Oh, thanks, man. Okay. So first of all, I also wanted to thank everyone for coming out today for the Soap for Hope volunteer. I think we were able to pack over 500 bags of food for the local children that need them. So that's really awesome. Yeah, so as fun as it is to participate in fundraisers and like the bottle drives and sort sticky bottles and stuff, we do actually have like a fundraising point system implemented. It's kind of like an incentive to get everyone to participate. And so the more that you fundraise and participate in the club, the cheaper your donation goal will be. And your donation goal is basically what you pay to go on brigade. There's several ways that you can earn points. You can attend volunteer sessions like Soap for Hope, even asking your profs to let us speak at the beginning of your classes for recruitment, participating in fundraisers, and then there's going to be various other opportunities throughout the year. And we're always going to post a point breakdown for each specific fundraiser. So like we see on the slide here, this is for our upcoming bottle drive on the 17th, which is this Saturday. Volunteering for 1 hour, you can get 10 points, bringing 1 bag of bottles, 5 points, and then sharing on social media is 5 points. And then the last thing I wanted to say was that there's definitely more room on the sign up sheet for the bottle drive this Saturday. So definitely sign up if you're able to come. It's at the Glanford Bottle Depot, 10 to 4. It's really fun. We have music playing and we just like hang out and talk. We provide gloves and masks. And yeah, even if you aren't able to volunteer for an hour, even just bringing bottles or just spreading the word is greatly appreciated and your efforts won't go unnoticed. I'm just going to pass it over to Zoe to talk about the upcoming fundraisers now.
Sierra, I just want to ask you too quickly. Have you posted the sign up sheet anywhere for them to go?
Oh yeah, I was going to say it's going to be in the meeting minutes this week. And we can also try to get it posted on the Facebook page. I thought that it was, but it might not be.
We'll take a look.
Yeah.
Awesome. Okay, so we have a few things in the works. Nothing is completely set in stone yet. I've been working really hard on a scavenger hunt for an upcoming event, and also a pumpkin carving contest. We're hoping to do a lot of this virtually, obviously, so that we don't have to worry about COVID restrictions. But I'm hoping by our next meeting, I will have everything set in stone, so I'll give you more information then.
Thank you, fundraisers, presidents, our campus chair. That was all great information. Looking ahead, I just wanted to explain kind of that monthly schedule post that we had on our social media. So this one here that my mouse is on is just giving you an overview of what you can expect each month. So week 1, you'll get something like this October monthly update. And then for weeks 2 and 4, we're gonna have Zoom meetings. These may be changed. We may have to maybe do the first week 1 month, but you will be given hopefully enough notice. And then on week 3, we're gonna put out some sort of education module. It might be like an in-depth, detailed document about the holistic model, like some important information that we think you should know, or it could be an interview with one of our past members that's gone on to do something, or with some of our connections in Honduras, which we were last year. So it's all going to be really cool stuff. We're going to make sure to keep you in the loop about everything, but it's really important that you stay up to date on our Facebook and our Instagram. And if you haven't done so yet, subscribe to our email so you can get our emails. But for October, the fundraisers just went over the important dates, and our meeting today we're going over. We have a meeting on the 28th, just going to be general info, and we'll do some more very fun icebreakers or activities. If you have any recommendations, send them my way, or something you don't want to do, you should also tell me. But yeah, that's about it. Does anybody have any questions from today?